everyone. My name is Dionne Apedjihoun. Thank you for joining us today as we go through our application information session for year 2 of the Urban Indian Organization Infection Prevention and Control System Champions. So welcome, happy to have you join us. Next slide, please. We have a robust agenda, but we'll go through quickly. We'll talk a bit about NCUIH, what we do, Project Firstline, what it is, what systems champions are, what the core requirements are for application, what eligibility looks like, what the selection criteria entails, and what should be in your application package. We'll also review key dates, and we'll talk about recruitment and discuss any questions that you may have. Next slide, please. Just a few housekeeping rules. Please turn on your video, mute your microphone when not speaking, enter your name and organization in the chat box. About NCUIH, the National Council of Urban Indian Health is a national nonprofit organization devoted to the support and development of quality, accessible, culturally competent health and public health services for American Indians and Alaska Natives living in urban areas. NCUIH is the only national representative of the 41 Title V urban Indian organizations under the IHS in the Indian Healthcare Improvement Act. NCUIH strives to improve the health of over 70% of the American Indian Alaska Native population that lives in urban areas, supported by quality, accessible healthcare centers. Project Firstline is a national collaborative led by the U.S. Centers for Disease Control and Prevention to provide infection control training and education to frontline healthcare workers and public health personnel. NCUIH is proud to partner with Project Firstline as it is supported through a cooperative agreement, and it's listed here. CDC is an agency within the Department of Health and Human Services. The contents of this program do not necessarily represent the policies of CDC or HHS and should not be considered an endorsement by the federal government. What's Project Firstline? It's the CDC's National Training Collaborative for Healthcare Infection Prevention and Control. Within this collaborative, we have over 75 partners. CDC's new Infection Control Training Collaborative is designed to help every frontline healthcare worker gain that knowledge and confidence that they need. Next slide. There are a few key features for Project Firstline that falls under empowerment, collaboration, and lasting results. Listed here are just a general summary of what those partners are. We have state, local, and territorial health departments, a number of healthcare organizations, as well as community colleges, various academia, four-year universities as well. Next slide. Let's take a look at what the key features entail. Under core training, this is used to address immediate workforce infection control training needs delivered via short and accessible training videos. These videos range from 10 minutes, 20 minutes to 60 minutes. The practical tools are created to support everyone working in a healthcare facility as they implement infection control protocols and procedures throughout their workday. Partner engagement. Within that 75 partner collaborative, partners get together to share information across all healthcare settings through trusted partners in channels, ensuring that training content and tools are delivered to healthcare workers who need them. Tools created by other partners are shared with our UIOs and made accessible as well. Mentorship is done to connect infection control experts with your local healthcare community so that they become an ongoing resource. Public health technical capacity building is done to leverage the public health workforce to facilitate knowledge and tool sharing between public health departments and their local health communities. There are a number of public health facilities that form the collaborative. Innovation to deepen knowledge, to better inform infection control recommendations, and to develop innovative platforms and content to provide infection control training to a diverse range of adult learners. As you can imagine, during this pandemic, with having to do most of what we do virtually, innovation has been key in developing key tools that we can use. Next slide. In the first year of Project Firstline at NCUIH, this fell under the Cooperative Agreement, OT 18-1802. The focus was on strengthening public health systems and services through national partnerships to improve and protect the nation's health. The general focus was on COVID-19 infections. For year two, however, we're going to be taking a broader approach and not only focus on COVID-19, but we'll be taking a look at all those pathogens, emerging and re-emerging infectious diseases that impact us. Hence, improving clinical and public health outcomes through national partnerships to prevent and control emerging and re-emerging infectious disease threats, as well as COVID-19. Next slide. Under this, there are various project topic areas ranging from environmental health to workforce development and others, such as taking a look at C. diff, MRSA, and other diseases that we've had challenges with. Or program strategies involve disseminate and adopt, inform and adapt, target and train as it relates to training content and delivery. Next slide, please. Who are IPC Champions? Urban Indian Organization, Infection Prevention and Control System Champions are UIOs selected after they apply for a competitive award to be champions, who pilot test the training modules developed with the CDC Project Firstline team and evaluate the modalities, which are platforms that host these trainings. Some partner organizations have chosen individuals as champions. However, NCUIH envisioned that for a program to be successful, that if the entire organization is involved in generating the trainings, promoting the activities, then we have a better chance of success. These champions will also implement in the IPC trainings developed by the collaborative within their organizations. We also work with champions to co-create products that we also share with our partners. If an IPC program does not exist or if it's not formalized, then the NCUIH team will work with the UIO to establish one by providing guidance and technical assistance and support. Next slide, please. What do our champions from last year look like? And we went ahead and we listed the 5 champions that were selected. Native American Connections, Bakersfield American Indian Health Project, Fresno American Indian Health Project, Denver Indian Health and Family Services, and the Urban Indian Center of Salt Lake were all champions that participated in webinars, community of learnings at our annual NCUIH conference. Next slide, please. For year 2, what is it that we're looking at in terms of what champions will be doing? The goal is to identify training needs, implement sustainable systemic changes in IPC, critical to a culture of safety, and to create organizations that are flexible and responsive to ongoing needs during emerging and re-emerging diseases, as well as the current COVID-19 pandemic. Last year, we selected five champions where the award was $40,000. For this year, we're looking at up to 10 champions, 10 UIOs, with the award increased to $60,000. The activities will range from January of next year to September 29th of 2022. We'll be focusing on emerging and re-emerging disease threats, inclusive of COVID-19. This requires commitment to complete a core set of required activities. The core requirements are less stringent than they were last year. We've pretty much slashed this in half because we wanted to focus more on quality over quantity. We're going to be focusing also on training system improvement activities facilitated by NCUIH and co-created by UIO Project Champions. We're going to be embracing champions as a teacher-learner partnership. This relies on involvement, experience-based, problem-centered, immediate, and relevant. And by that teacher-learner relationship, we had a number of our champions co-host a number of the webinars, working in tandem with the CDC infection prevention experts to create training modules and deliver them to our UIO audience. NCUIH brings support in multiple performance improvement methodologies. Access to CDC's Project Firstline partners and subject matter experts is also an option. We have the option to participate in training activities provided by partners within the collaborative. For example, the American Nursing Association is a partner. They have a number of conferences where training, infection prevention training and other training is provided to the nursing workforce. We're working with our partners to make this, something like this, available to our nursing or clinical staff within our UIOs. Another feature is access to professional development scholarship opportunities for staff, independent of the championship or inclusive of the championship. Next slide, please. What will UIO IPC System Champions do? They'll support information gathering, training module, and modality development. And by modality, we're referring to the different platforms that we put our training on. And participation in all healthcare workers training within their organizations, including potential participation in CDC-supported project activities. We have included in this proposed training plan on IPC for all staff, develop and implement an infection prevention control training plan that incorporates content identified as relevant and necessary for your UIO. If you already have a training plan in place, we can review that with you and help you to augment that. We require that you designate a staff member to participate in the entire CDC training module and the different course elements and provide evaluation in the form of a survey. It does not have to be the same staff member, but you may choose 2 or 3 staff members. But as long as your site is represented and that information is shared, then that can be done. We ask that you participate in 15-minute monthly UIO IPC Champions phone call with the NCUIH staff. And this is just to touch base, see what's happening with your project, see if there are additional needs, and to share information. We ask that you submit required agreements, reports, and evaluation components over the course of the project. Next slide, please. As I mentioned before, the core requirements have been trimmed so that we can focus on the quality. Designate the staff as a project director, have at least 1 staff person participate in the various activity, participate in the 15-minute monthly champion calls. We ask that you develop a job-specific training plan and propose metrics to recruit, train internal staff on infection control content, training content, and resource provided based on organizational needs. Convene or continue a multidisciplinary committee, infection prevention and control committee, conduct an assessment to see where the weaknesses lie. And this is basically a gap assessment. There are 2 tools provided, one from the World Health Organization and one from the CDC, which we found to be very helpful and user-friendly, and we recommend the CDC based on the services that you provide to use this tool. This will help you to identify gaps within your program, and we'll work with you to meet those gaps, to come up with solutions. Provide professional development opportunities to staff to participate in conferences or training sessions within the scope of infection prevention and control. And what's missing here is a list of potential opportunities which are continuously updated. Next slide, please. Eligibility must be one of the 41 UIOs who are listed as active members on the NCUIH website that are currently funded by IHS under Title V. We also ask that you submit a complete application package. If you have any issues during the submission or any questions prior to, you can email us at ipc@ncuih.org. And I'll ask Aliyah to drop this in the chat so that you'll have it ready to go. Next slide, please. Selection criteria. Incomplete applications will not be reviewed. Overall impact of the proposed IPC training plan, we're going to be looking at that. We're also going to be looking at a willingness to participate based on your application, a commitment to complete the course set of required activities, and we'll ask you to sign off on that. Preference will be given to selection of at least 1 UIO that represents each of the 4 program types: full ambulatory, limited ambulatory, outreach and referral, and treatment centers. And we'll be taking the top 10 applicants. Next slide, please. Your application package should have UIO information form, your project narrative and work plan, a project budget outlined, and acknowledgement of the core requirements, and that you sign the application. Next slide, please. What does the application look like? Once you get on to the website, these are easy to fill in. If you're unsure of the information, you can put uncertain or not applicable. If you get stuck, please feel free to reach out to us. So there's a section on Urban Indian Organization. Next click, please. You'll go into who your administrative contact is. And we ask that there be two people assigned. If we're not able to connect with your designated main contact, then there should be a backup so that the work continues. Next click. And then we also ask that, that you sign the application once this is complete. Next slide, please. Your project narrative, no more than 5 pages. It could be on 1 page if you feel that you can get everything that you need to share. We'll ask that that the narrative include a statement of need, impact of COVID-19 on your UIO, current infection prevention and control practices and programs, any emerging, re-emerging disease threats that your organization faces. Your training plan should describe the impact. You want to include your overall goals and your objectives as well. We ask that you propose, and this is a typo, of course, we ask that you propose IPC training description overview. We ask that you include an evaluation plan and as well a sustainability plan, meaning once you've implemented your training plan, what do you project as a future methodology to keep that sustainable or fresh or ongoing? And you'll sign off on this. Next slide, please. This is just a template that we provide. You can create your own, but this is here to help you, and you can select 1, 2, or 3 goals for or any. It's totally up to you what you're working on, what your goals are, but the options are here for you. Next slide. Your budget. And this is key. We ask that this adds up to the 60,000 that's going to be in the award. We do understand that some UIOs are short-staffed, that you may not have sufficient staff for this project, but with the funding provided, you're able to hire or contract for the services that you require to be able to stand up this program. We're asking that you estimate what you think your expenditure will be based on the line items provided here. Again, this is just a template to guide you. If you prefer to use your own budget table, then go ahead and do that, and you can attach it. Next slide, please. For the acknowledgement and signed agreement, above this is a list of core requirements. We ask that you sign in terms of acknowledgement, and that you list the name here, and this will be your signed agreement and acknowledgement that you've committed to the core set of requirements and signing off on your application. Next slide, please. What are key dates to keep in mind? So we've pushed the deadline back as far as we can to accommodate for the holidays. So the 3rd of January is the deadline for the application. If you are running into issues, please reach out to us and let us know. We are going to have a concierge service where we can walk you through the application, help you to problem solve. If there are issues submitting it through that particular channel. We did have one UIO who had run into issues last year, and they opted to email their application to ipc@ncui.org. So definitely do not be frustrated with the application process. If you feel that there are issues, then go ahead and email us. The applicant notification of status will go out on the 7th. So you will be notified if you've been selected. We're hoping to have, and if you are, you'll be getting a funding agreement as well as a contract for signature. I do know that it's very challenging to get our CEOs or EDs sign off on these documents because of the time required for review and because of their busy schedule. And we're asking that if you run into issues, please do let us know, and we'll work around that. The project estimated start date is the 11th of January, because this is when we'll have our orientation with our fellows, subject matter expert, and a CDC representative will be there to greet everyone as well. Next slide. Are there any questions? We've included a QR code if you wanted to take a look at what that application looks like. You can go ahead and scan. And I'm opening the floor to any questions you may have. And I see that Donnie Delgado has added a question here. Are there any budgetary restrictions, such as the maximum amount that can be allocated to any field? No, we have not restricted you in terms of the amount that can be added to a field. The total should come up to $60,000. Are there other questions?
I did have another question as well. So for the grant period, I'm assuming the start date then would be, well, when would it actually be the start and end date for the grant?
So the orientation date of the 11th of January is the start date, and the grant period ends on September 29th of next year.
Thank you.
You're welcome. Any additional questions?
I just have a quick comment. Maybe it'll lead to a question. This is Angel with Bakersfield American Indian Health.
Welcome.
Thank you. You mentioned with the contracts and the contracts being executed by the CEOs, well, first of all, I think it's important that us as CEOs make ourselves available to someone within the team so that the team can have access to expediting promptly those contracts, because obviously sometimes that becomes a bit of a challenge and then they miss out on important dollars. Will a email suffice, perhaps even if the CEO was to acknowledge that, yes, we're interested in this and I'll execute the signature soon to expedite the actual contract? Will a email communication from a CEO suffice for the sort of kind of contract approval? Right.
Yes, definitely. Just a feedback to let us know that you are interested, that you are reviewing the document, that you will sign and get it to us. We can move forward with the orientation date and coordinate getting that document to us. But definitely let us know what's happening on your end, and we'll be flexible with that. That's a great question.
That's great. Thank you.
Are there other questions?
With the request, the form that you had up there for the work plan, I believe it was, is that available on that link you get? Do the QR code or?
QR code will take you to the entire application. And because certain fields are required, you're not able to move to the next page until you fill that out. But as you click through, there will be a section where you can click on a hyperlink and it will bring you to the work plan. Again, if you wanted to have these documents independent of the electronic application, we can just email us at NCUIH.org and we can send these to you so that you have those handy.
Awesome. Will do. Thank you.
You're welcome. So we've got 4 minutes left. Are there additional questions? Thank you for joining, Mr. Galvez. Yes, UIOs can reach out with questions before completing the application. This is a part of the concierge service that is available. If you wanted to have a closer look, we can walk you through that application and discuss any questions that you have. Email us at NCUIH.org and we can schedule an appointment for you. I do know that for last year, we have a number of UIOs who felt that they did not have a project in mind when they wanted to apply for this program. Again, you can reach out with us and we can talk about the services that you provide. And Johnny, I'll mention your site here for Bakersfield. One of the services you provided was home visits to patients. So we took a look at what does IPC, infection prevention and control, look like for staff leaving the clinic and going into the homes of patients. How do you train on that? What policies and procedures do you need to have in place to ensure that workers are safe? So that became part of their project. So we can think strategically about what's happening within your organization and what potential training plans you could implement around infection prevention and control for emerging and re-emerging disease threats. Are there additional questions? So if there are none, I will give you back a few minutes of your time. Thank you so much for joining us. We are providing here for you again links to the applications. We will have graduate students who will be fellows, who will be supporting the various champions with their projects. We're also looking for a trainer facilitator to join our team. There is a link here for application. We're also opening up to our UIOs. If there are any guests, anyone who wants to be a guest speaker at our various events, there's also an application link here. And I'll ask Aliyah to go ahead and drop these hyperlinks into the chat so that you can have access to them. Thank you so much for joining us today.